As men get older, their bodies go through a lot of changes, and that includes sexual health. While it's common to talk about heart health, joint health, or even mental health after 60, penis health is often overlooked, stigmatized, or wrapped in silence. But the reality is, a healthy penis is directly connected to your quality of life, confidence, and intimate relationships. If you're over 60 or getting close, it's time to take penis health seriously. And the good news? With just a few daily habits, you can improve circulation, maintain function, and boost overall well-being. So here are 5 important tips, practical, evidence-based, and easy to follow, that every older man should know. Maintain good blood flow with daily physical activity. Erections are all about blood flow. And as you age, circulation naturally declines due to the buildup of plaque in arteries, lower testosterone levels, and reduced flexibility of blood vessels. That's why daily movement is essential. You don't need to run marathons. A 30-minute walk, some light stretching, or low-impact exercise like swimming or cycling can do wonders for your cardiovascular system. When your heart is strong, your penis benefits too. Improved blood flow not only supports firmer erections, but also contributes to nerve health and sensation. Additionally, staying active helps control weight, blood sugar, and cholesterol, all of which are linked to erectile dysfunction. The more you move, the better your body performs. And yes, that includes performance in the bedroom. Pay attention to what you eat. The phrase, "you are what you eat," isn't just about abs or weight. Your penis health is influenced by your diet just as much as any other part of your body. A Mediterranean-style diet, rich in leafy greens, nuts, whole grains, berries, olive oil, and lean proteins, has been shown to support vascular and hormonal health. Avoiding heavily processed foods, sugar, and excess red meat can reduce inflammation and lower your risk of conditions like diabetes and heart disease, which are leading causes of erectile dysfunction in older men. Some specific foods like watermelon, dark chocolate, beets, and even garlic can enhance nitric oxide levels, a molecule that improves blood vessel dilation and helps support natural erections. The takeaway? Every plate is a choice that either helps or harms your sexual health. So choose wisely, and your body will thank you. Don't ignore your hormones, especially testosterone. Testosterone levels naturally begin to decline after age 30, but the drop becomes more significant for many men after 60. Lower testosterone can lead to decreased libido, reduced energy, and even mood swings. It can also play a major role in erectile difficulties. You don't necessarily need hormone replacement therapy, though for some men that may be appropriate under medical supervision. But there are daily steps you can take to naturally support healthy testosterone levels. Prioritize good sleep. Aim for 7 to 8 hours per night. Poor sleep, especially due to conditions like sleep apnea, is linked with low testosterone. Cut back on alcohol. Excess drinking, particularly beer and spirits, can suppress testosterone production and lower sexual interest over time. Strength training, like lifting weights or using resistance bands, can also boost testosterone levels naturally, even in older men. If you're experiencing persistent symptoms of low testosterone, talk to your doctor. A simple blood test can give you a clearer picture and help you make informed decisions about treatment. Practice proper genital hygiene. This might seem basic, but daily hygiene becomes even more important as you age. Reduced flexibility, poor eyesight, or even arthritis can make thorough cleaning more difficult, leading to issues like infections, irritation, or unpleasant odors. Use warm water and mild, fragrance-free soap to wash around the genitals every day. If you're uncircumcised, gently pull back the foreskin and clean underneath. Dry the area completely to prevent fungal growth. Also, wear breathable cotton underwear and avoid tight-fitting clothes that can restrict blood flow or cause chafing. Good hygiene reduces your risk of infections like balanitis or urinary tract infections, both of which are more common in older men. And one more thing, routine self-checks are important. Pay attention to lumps, sores, or changes in color. If you notice anything unusual, see a healthcare provider promptly. Prioritize mental and emotional well-being. Sexual health isn't just physical, it's deeply connected to your mental and emotional state. Anxiety, stress, depression, and relationship issues can all contribute to reduced libido or erectile dysfunction. Take time each day for activities that help you feel grounded and connected. Whether it's meditation, journaling, reading, or simply spending quality time with a partner, your mental health plays a vital role in maintaining a healthy sex life. If you're in a relationship, open communication about needs, expectations, and concerns is key. Many older men experience performance anxiety or body image issues. Talking about these things can relieve pressure and foster intimacy. And if you're struggling emotionally, don't hesitate to speak to a therapist. There's no shame in seeking help, and doing so can dramatically improve both your emotional and sexual well-being. Final thoughts: penis health. After 60 isn't just about sex, it's about quality of life, confidence, and personal wellness. While aging is inevitable, decline doesn't have to be. The 5 daily tips we've covered, staying active, eating smart, balancing hormones, practicing good hygiene, and caring for your mental health, can make a real difference. You don't need to chase youth. You just need to take care of the body you have, with intention, attention, and a little self-respect. Age gracefully, live fully, and let your health, including sexual health, be part of your vitality, not a limitation. Stay curious, and most importantly, stay in charge of your health. Let's take the conversation a little further. While those 5 daily tips form the core of good penis health after 60, there are additional areas that deserve attention. Things that often go unspoken but can make a significant difference in both daily life and long-term wellness. Understanding erectile dysfunction. Beyond the physical, erectile dysfunction, or ED, is incredibly common in older men. By age 60, nearly half of men experience some degree of it. But while physical factors like circulation, nerve function, and hormone levels play a role, it's not just a physical issue. ED can also stem from performance anxiety, relationship, stress, or feelings of inadequacy. It's not uncommon for men to internalize these issues, thinking they're failing or less of a man. This mindset can spiral into avoidance, shame, or even depression. What's important to understand is this: ED is not a moral failing. It's a health issue, just like high blood pressure or arthritis, and it's often treatable. Open dialogue with your healthcare provider can uncover solutions, whether it's medication like PDE5 inhibitors, lifestyle changes, therapy, or a combination of strategies. Never assume it's something you just have to live with. Help is available, and many men regain satisfying sexual function with the right support. The importance of sleep and recovery. Most people don't connect sleep with sexual health, but they're intimately tied. During deep sleep, the body releases hormones, including testosterone and growth hormone, that support sexual function. Disrupted sleep, especially from issues like insomnia or sleep apnea, can wreak havoc on these systems. If you're waking up feeling unrefreshed, snoring heavily, or experiencing daytime fatigue, it may be time to get a sleep study. Treating sleep disorders doesn't just improve energy, it can also restore libido, mental clarity, and mood. Even if sleep apnea isn't the issue, setting a consistent bedtime, limiting screen exposure before bed, and avoiding caffeine late in the day can dramatically improve sleep quality. Better sleep equals better hormonal balance, sharper thinking, and more resilience in every part of life, including your sexual health. Stay sexually active, even if it looks different. Another important point: sexual activity changes with age, but that doesn't mean it disappears, nor should it. Many men believe that aging means saying goodbye to their sex life, but sexual activity can continue well into the later decades, and in many cases, it becomes more emotionally satisfying and connected than ever before. However, expectations may need to shift. Erections may not come as quickly. Orgasms might be less intense. The frequency of desire could change. These things are normal, not signs of dysfunction, but natural evolution. The key is to stay engaged. Intimacy doesn't have to be defined by penetration alone. Touch, communication, massage, mutual exploration. These all count as meaningful sexual experiences. What matters is that you and your partner remain connected, curious, and compassionate with each other's changing bodies. And if you're not currently partnered, don't think that intimacy is off the table. Many older adults form new relationships in their 60s, 70s, and beyond. A healthy sex life doesn't expire, it simply matures. Routine health screenings. Not just for the heart. A lot of men don't realize that certain routine health screenings directly affect penis health. For example, diabetes screenings. High blood sugar damages blood vessels and nerves. Two things crucial for erectile function. Prostate checks. An enlarged prostate or prostate cancer treatment can impact ejaculation and erection quality. Cholesterol and blood pressure monitoring. High levels damage arteries and reduce blood flow to the penis. Testosterone tests. As mentioned, low testosterone can quietly sap your energy, mood, and sexual desire. Seeing your doctor annually for a full physical and being open about your sexual health is not just wise, it's empowering. These conversations are normal, and your physician should be trained to help. Mindfulness, stress reduction, and its surprising link to erections. Here's a less obvious, but incredibly effective, tool. Mindfulness. Chronic stress activates the sympathetic nervous system, that fight-or-flight response that constricts blood vessels and diverts energy away from non-essential functions like sex. Over time, stress can cause your body to down-regulate libido and suppress the relaxation response needed for erection and arousal. Mindfulness meditation, breathing exercises, yoga, or even mindful walking can reverse this pattern. By lowering stress hormones like cortisol and increasing your sense of control, you allow your parasympathetic system, the rest and digest response, to become dominant. This is the system responsible for arousal, erections, and sexual enjoyment. Incorporating just 10-15 minutes of mindful breathing or meditation into your day can yield benefits far beyond mental peace. It can rewire your entire sexual response. A note on medications and their side effects. Many men over 60 are on prescription medications, and that's okay. But it's important to understand that some common drugs have sexual side effects. For instance, medications for high blood pressure, depression, anxiety, or enlarged prostate may interfere with libido or erectile function. If you've noticed, changes that align with when a medication was started or adjusted, bring it up with your doctor. In some cases, there are alternative drugs with fewer sexual side effects. Never stop medications on your own, but don't suffer in silence either. Your health and well-being matter, and your treatment plan should reflect the full picture of your life, including your sexual health. Building confidence and self-esteem, one last piece that's often overlooked. Self-perception. A man's view of his own body, desirability, and masculinity plays a huge role in his sexual identity and confidence. Aging can sometimes feel like a loss of these things, especially in a culture that glorifies youth. But here's the truth. Confidence doesn't come from looking young. It comes from knowing yourself, being present, and embracing your worth at every stage of life. Whether you've gained weight, lost some hair, or feel different than you did at 30. Remember, your value is not defined by physical perfection. It's defined by authenticity, communication, kindness, and how you care for your body and relationships. Owning your age, your needs, and your growth is the most powerful and attractive thing you can do. Let this be your reminder. Penis health. After 60 is not a side issue. It's a vital part of your physical, emotional, and relational well-being. It's about more than erections or libido. It's about living fully, aging intentionally, and taking ownership of your health. So walk each day. Eat for your heart and hormones. Tend to your mind and body. Keep the conversation going with your doctor, your partner, and yourself. This chapter of life can be vibrant, sexy, and deeply connected. You just have to treat it that way.